Today, I have a confession to make. And in fact, it was my biggest shame in my career as a physician. And you're not going to like it. Today, we have a hot button topic. In fact, this question was in the Facebook group earlier this week. And we talked about why are conventional doctors so dead set against a functional or root cause approach in dealing with autoimmunity? And I'm guilty of saying those things myself.
You mentioned that you have this and it's a shame that you feel on yourself, but this is something that kind of haunts you about your previous medical path.
Absolutely. And so I think the biggest thing about this is that I think the go to for conventional, we call conventional doctors your regular primary care doctors or the specialists that you're dealing with. And the biggest disdain that people get is that their doctors has tons of objections to it, will say it's a scam, it doesn't work, and talk them out of it, or dismiss what people are bringing up to them. And I find that the vast majority of public is actually getting educated about root cause approach of functional medicine, not from their doctor, but from their own research and from them watching videos just like this. And then when they bring it to their doctor, they are met with nothing but obstacles, right? So this is the crux of the problem. We hear this all the time, and we have some heartbreaking case and case examples that really made my blood boil, which was why we wanted to do this panel today. And
Mhm.
I was like, why don't we give people a behind the scenes look? The top docs that are practicing in functional medicine, what is the behind scenes of how we have to deal with our colleagues? What did we do before we became functional medicine doctors? And why did we become functional medicine doctors? This is a very rare, unique behind the scenes look from behind the trenches that you're never going to get anywhere else. And I have the top docs on the planet, people I like, just these are colleagues I love. So I would love to bring them on and have them introduce themselves and get this panel on the road. Okay, so we've got some top docs here, and I'm going to ask each of them to do a quick introduction to tell you why I think they're so great. So, Rob, I'm going to have you get started. Dr. Floyd.
Hi, my name is Robert Floyd, double board certified MD and a functional medicine certified physician. And was fortunate enough to meet Maggie at a training session, and she told me what she was doing, and I was just blown away of her success. And I really kind of wanted to emulate it. And one of the reasons that I kind of went towards functional medicine is because I'm kind of an outside the box thinker. And having spent best part of the last 15 years in medicine, I'm looking at it, and it's, to me, it's just like putting band-aids on severed limbs. It's a little too little and a little too late. And unfortunately, it is what we're all taught in medical school is diagnose and treat, diagnose and treat, diagnose and treat.
Yeah.
Well, it's much deeper than that. And you are not a lab value. You are not a disease. And so what I liked about functional medicine was that I could look at everybody as a whole. And my first intake is 90 minutes. I ask about their diet, their lifestyle, their exercise, social support,
Yeah.
spiritual support, everything that makes a person a person. It's not just, hey, your TSH is off.
Yeah.
And coming from, I've had extensive training. I did 2 years of trauma surgery and critical care training in
Yeah.
Vegas. I then did family medicine. I then did emergency medicine and hospitalist. And then I moved into my own integrative practice. And thank you to Maggie Yu, shout out to her again. She really prodded me to get into this space, the online space where I can make a bigger difference and help more people at a time.
Yeah.
In a clinic setting, I can only help one person at a time. In this setting, I can help, tens of
Yeah.
thousands. And, again, thank you very much, Maggie. I appreciate you prodding me to go this direction.
And Robert, I mean, you're really shaking things up with your metabolism program, helping people with their metabolism. And there's so many functional root causes of that. So he's top doc metabolism. And next we have Chris Winfrey. Dr. Winfrey.
Uh-huh. I'm Dr. Winfrey. I'm a psychiatrist in New Jersey. I practice functional integrative approach, kind of bringing everything I can to help people who are struggling with neuropsychiatric problems. I met Dr. Maggie when I saw a couple of her online videos. She was quick, witty, spicy.
For sure.
You're making me blush, Chris.
And so I had a couple family members that I thought would benefit. I was trying to
Yeah.
help them get on this path. And I said, you know what? She has a structured program. I thought they needed some structure and some guidance and things. sent them to her. And it really was helpful, giving them a really good foundation and things to spring forward and to do, because they were feeling really lost and hopeless. And although I was a trusted family member, I was still part of the medical community, which they were still trying to wrap their heads around what I was saying. So it was great to have that intervention from them. So thank you for that. I got to functional medicine. I always just felt that medicine I was practicing before, I was doing it as a formality, going along with what I was told. But
Yeah.
I didn't think that it was the full picture. I always felt that something that was missing. And I just always continued to follow that intuition. And I kept my ears open, and I would hear somebody say one thing at one point or a conference, and it just kind of spurred till I got to the point where I'm at now. Certainly my own health challenges brought me further into this
Yeah.
space to kind of dig deeper and kind of figure out ways that I could better advance that. So that's how I got to this space. And I'm happy to be in this space. And I think it's a great transformative experience for people willing to embark upon it.
And Chris, I've known you several years, and to watch you transition from traditional psychiatry into practicing functional psychiatry every day has been super rewarding. And I know that was your dream, and you're there.
Yes,
I
absolutely.
love it. And then Senya, a lot of people don't realize that acupuncturists and how they can become functional medicine providers. I'd love for you to introduce yourself with that.
Yeah, so I have a doctorate in acupuncture and Chinese medicine, and I've been doing that for 14 years. Before that, I was an engineer. I was a biomedical engineer, so I have a very scientific background and was practicing a lot of holistic medicine with Chinese medicine, which is fantastic. But I really felt like I was limited in how I could treat autoimmune conditions with Chinese medicine because it's very reliant on acupuncture and herbal medicine. And there's so many like underlying causes that contribute to autoimmunity. And if you're not doing some of the lab testing, you're not getting that objective information. So we can guess and we can try some things out when you're doing that holistic approach. But if you can truly get that data, then you can really refine a treatment for somebody for the long term so that they can have, they know what their food sensitivities are because they've done food mapping. They can use that for the rest of their life. Like we can look at what their hormones are doing and balance those, and they have lifelong benefits from that. So I really wanted to kind of pull some of the science back into the holistic medicine that I was already practicing.
Right.
And Maggie and I, so we also met at one of the IFM conferences, and Dr. Floyd as well, all three of us, I believe we're sitting together. So
Table 12.
at table 12 in Seattle before the pandemic. And I was so impressed with Maggie's program because I could see how many people you were helping. And I really wanted to know how you could make such a huge impact. Because again, I'm a private practitioner. And then I was very fortunate because as part of my doctorate training, I reached out to Maggie and said, hey, so they want us to do something that's not acupuncture and Chinese medicine. I want to do functional medicine. Can I intern under you? And she said, heck yeah. I mean, she called me up within an hour. Like, yeah, let's talk about this. How can we do this? And I got to spend months just learning from her and absorbing everything that she was doing. It's such a mind-blowing program that I emulated. I use it in my practice today.
So I want the audience to understand that we've got an internal medicine doc with Dr. Floyd who specializes in functional metabolism work. We have a functional psychiatrist with Dr. Winfrey here. And then Dr. Senya here is a functional acupuncturist. Did you know that there's all these different types of functional doctors, right?
Nope.
Functional medicine doctors who've actually received accredited training in functional medicine. People in the audience, a lot of them know my story, is that I, as a result of my own illnesses, really dove into, quite by accident, the world of functional medicine. This is 20 years ago. And so it was before there was even what we call functional medicine, right? And so for me, I recall, and I'm going to talk about what did I say to patients when I was a practicing family practitioner, a good one and a caring one, when they came to me asking about root causes. I would have a patient and I'm treating people for high cholesterol, high blood pressure, and they come to me and say, Dr. Yu, what do you think of red yeast rice? And I'll be honest, the only training I got out of all my 4 years at UCLA, one of the top medical schools in the country, I did residency for 3 years after that with UCLA and at Kaiser. And then I was a practicing physician for years after that. All that training, do you know how long total I had in learning about supplements, nutrition, or alternative medicine? The total, Senya, was 30 minutes in that entire period of time. So no wonder, when people came and asked me for it, people come to a regular doctor, their family doc, their psychiatrist, their internist, their acupuncturist. They come to us and they think, we know everything about this and we're here to give them an educated answer about this. And my answer was, there's no data behind it. And the reason I said that was I was told to protect my own hide. because we have what we call standard of care. We practice medicine, and the standard of care for someone with high cholesterol is you got to give them a statin. You have to give them a medication. We're drilled into our heads. Evidence-based medicine is that you have to give everybody a statin for high cholesterol. And if you don't talk about it, you don't sell it as the first and only step, you could possibly be sued for malpractice because you're not practicing standard of care.
The reason I'm in this program and in this realm is because I looked at what was going on and I'm like, this isn't right. You know, I need to do better for my patients.
I have actually great hope for the medical profession. And the reason is all the medical profession that's around me today, these are all doctors who practice in a conventional way in their field before actually getting this education, paying on their own dime with their own time to actually do this against the grain. It's an incredible act of courage and investment in themselves. And what I'm seeing as well in the program, at least 10, if not 15% of the people joining the program, Anne, are medical providers.
Hi, I'm June. I'm 51 years old. I've been a physician assistant in ear, nose, and throat for 18 and a half years. You know, as a provider myself, I like to treat the whole patient as a well-rounded person versus just one thing.
You're a rare provider at that, lady, especially for an ear, nose, and throat physician assistant.
Yeah, that's
Ear,
why I was
nose, and
drawn to
throat.
you.
ENT is not holistic.
No, we're not. But I love functional medicine. But that's what drew me to you because, you know, some functional medicine doctors will concentrate on just the gut or this or that, but you encompass the whole thing.
You know, Michonne, just from a nurse practitioner and someone working in the medical field point of view, did you receive any training on any of the stuff that's really your root causes?
No, I didn't. And I told Gary, I was like, my gosh, if I had known this stuff a long time ago, number one, I'd have been a better practitioner.
Hell yeah.
Two, I may not have ever developed an autoimmune condition.
Hell yes.
If I had known this stuff. So yeah, a lot of it was really eye-opening.
For me, I think one of the biggest things is that functional medicine absolutely is data-driven. In fact, it's more data than conventional medicine. We have even more training than regular doctors do around this. And I think data is actually crucial. If you think that you have something that could benefit from a functional medicine approach, type it in chat right now. I would love to hear what that is. You could get some feedback. We have thousands of resources, interviews, trainings, case studies to be able to share with you. I want this information accessible for everybody, but we're not going to be able to get it to you if you don't raise your hand. So go ahead in the comment section, raise your hand, tell us more about you, and we'd love to get to know you more.